remain at 5. We have released from isolation and quarantine 144 individuals, and we continue to have very low active cases of 23. I am also, as a result of the numbers that we are seeing and our conservativeness to make sure that we contain this coronavirus, I have decided to extend our public health emergency until June 30th. Also, in relation to, again, our success in containing this virus, effective on June 1st, I am going to reopen our all GovGuam agencies, and they will resume operational hours from 8 a.m. to 5 p.m. under certain conditions. Guidelines will be provided by the Department of Public Health and Social Service, and we will also use the next few days to implement our operational plans for reopening. We will be adhering to the 50% occupancy mandate. Category 3 then of the COVID-19 response differential pay plan will expire once we open all our government agencies. However, government of Guam employees who are out there as the frontliners and who are in the high risk areas, as we had defined in our executive order, categories 1 or 2 of the COVID response plan shall be compensated at their regular rate, regardless of whether work occurs in their physical workplace or via telework. And that's with the category 3 individuals who have now are required and are asked to come back to work. We will also allow physical work at home or via telework, of course. Updated quarantine protocol effective Monday, June 1st. We will be implementing a new protocol for the quarantine of travelers into Guam. Current returning and intended residents of Guam, persons who are essential healthcare or other essential workers, or persons who have traveled to Guam because of an emergency or a personal hardship situation, may be allowed to complete their 14-day requirement for quarantine at their home residence or at their rental lodging location. They must also be able to verify their identification, and we will be accepting valid Guam IDs, a mayor's verification that you are a resident, or the individual can sign the declaration of residency upon arrival. Non-residents will still be subject to quarantine at the GovGuam designated quarantine facilities. We will, however, also accept diagnostic specimen testing for the non-residents, such as PCR, with samples taken at most 1 week prior to arrival. And this is to allow them then to self-quarantine at their rental lodging. Currently, there are no effective medicines or vaccines available to treat or prevent our COVID-19. And multiple studies have shown that quarantine, whether at home or at a government quarantine facility, can play a role in controlling the spread of COVID-19. A few of our confirmed cases have been identified at the government quarantine facilities. COVID-19 symptoms may appear 2 to 14 days after exposure to the virus, and those who are asymptomatic can still spread the virus. Thus, our requirement for quarantine. We are also announcing a conditional opening again for tourists from Japan, South Korea, and Taiwan effective July 1st. And what we are doing this to prepare our industry, tourism industry, to make the necessary plans and preparation to then bring back our tourist industry. This does not mean that anyone entering from these countries can bypass any form of measures to prevent the spread of COVID-19. Protocols have not been established yet for these countries, but my travel advisory team is working closely with the tourism industry to develop guidelines and issue them before July 1st. So I will be in constant communication with our travel advisory group to provide the guidelines and the details of what other measures we will be looking at once we lift this quarantine from these for our tourists. I also want to make note of great importance that we will be continuing to monitor very closely our community spread. We will be monitoring our positivity rate. We will be monitoring our capacity at the hospital. We will be monitoring our capacity to contact trace, our capacity to test. And if any of those are alarming to us based on numbers that we have set, we will, and I will, make sure that we continue to protect our people by putting back some of the restrictions. I hope this helps in some way to allay some of our concerns. And as you know, we are going to be slowly opening our island and lifting restrictions. But most importantly, we are going to continue putting in measures that would help protect the health and safety of our people. I'd like to ask now Linda DeNorsi to please give her update on public health, COVID-19.
Thank you, Governor. Of the 172 COVID cases, 143 are local, 14 are U.S. Naval Hospital tested through their DoD lab, which is in San Diego. 2 cases are confirmed by GMAJ, 6 cases confirmed by DLS, that's Diagnostic Laboratory Services, and 7 probable cases of COVID, and that equals to 172. Now, of the 172, 20 are with travel history and 152 without any travel history. And the breakdown of that 152 are as follows. Household contacts, they're 40. Community contacts, 28. Healthcare contacts, 19. And breaking down the 19 further, as a patient contact, 5, and as a healthcare worker, 14, and that totals 19. No reported contact is 65, and so the grand total is 152 with no travel history. I also like to add on that in the next couple weeks, we will continue our outreach activity as the governor had indicated. And I just like to give an overview of what we have already in mind as far as what we're going to do. On June 3rd, on Wednesday, we will be visiting the village of Jigo from 9 a.m. to 12 p.m. And all the Jigo residents will be there. And the location will be at the Jigo Gym. It's a drive-through. On Thursday, June 4th, from 9 a.m. to 12 p.m., we'll be at Dedido at the Gura Senior Housing and Public Housing. And the location will be, again, at the Dedido Gura Senior Housing and Public Housing. On Friday, June 5th, from 9 a.m. to 12 p.m., we will be at Sinahanya for all Sinahanya residents. And the location will be at the Sinahanya Mayor's Office. And that, again, is a drive-through. On Monday, June 8th, from 9 a.m. to 11, we will have it in our Central Public Health Facility for all the Palau residents that are returning back to Palau. And then on Tuesday, June 9th, from 9 a.m. to 12, it will be at Inarahan for all our Inarahan residents, and it will be at our Southern Public Health Community Health Center parking lot. And again, that's a drive-through. On June 10th, from 9 a.m. to 12 p.m., it will be at the Mongmong Toto Maiti, and that will be for all the residents, and it will be located at the Aragon Street, Mongmong Toto Maiti, across the Toto Church. And then on June 11th, from 9 a.m. to 12 p.m., we will have it at the Marizo Senior Center. And on June 16th, from 9 a.m. to 12 p.m. at PD, and that will be at the PD Mayor's Office. And then on June 17th, from 9 a.m. to 12 p.m., it'll be at the Santa Rita Senior Center. And June 18 from 9 a.m. to 12 p.m. It'll be at Tamuning at the Tamuning Gym. Thank you, Governor.
Thank you, Linda. We'll open it for questions now.
Thank you, Governor. And I'd like to just once again remind the media that you get one question and one follow-up. And I know we had some media who asked more than one question and one follow-up question at our last press conference. But again, just to be fair to everybody, if you can please stick to this format. We'll begin with I-94. Chris Barnett.
Thank you. Hi, Governor.
Hi, Chris.
Hi, Linda.
Hi, Chris.
Happy Friday, guys.
Yes, and when you go out to dine, make sure you social distance and adhere to the measures that we are asking people to take to continue protecting our people.
Right on. I'm going to give it a couple weeks, Governor, just to wait and see how it works before I go out to eat. My question is for Linda. Linda, we were looking at the public health situation report. On Thursday, a total of 117 PCR tests were ran at multiple lab locations on island, and one sample turned up positive. The new case is a man in his 50s who lives in northern Guam. According to the SIT report, he was identified at a community testing site, was asymptomatic, and didn't report contact to a confirmed case. The SIT report did not indicate any household contact, no healthcare contact, no community contact, and it doesn't appear he's homeless because there was no increase in that category. The PCR result for this new case was ran through Public Health's lab and was identified as a community testing site. Yesterday's testing site was in Tamuning at EPAL. What can you tell us about this new case other than the information I just provided from your SIT report?
Yes, actually we did do 63 tests yesterday. And if that's what you're alluding to, we did have a positive test yesterday. And that positive test was from a homeless individual.
Is there anything else you can tell us, Linda?
At this time, not at this time. We're continually doing our contact tracing.
Okay. Governor, my next question was for you. I know that we're extending the public health emergency for another month, but what would you say to those people who are kind of scratching their heads that we're extending a public health emergency, but everyone's going back to work and we're opening everything at the same time? Can you maybe provide your justification for extending the emergency?
Sure. We're not totally out of the woods. We can still, again, see surges, and we can still see more positive cases, Chris. I'm hoping that we don't. And I feel that in order for me to continue using personnel resources, using financial resources, using federal resources to provide for the necessary actions and decisions should these kinds of emergencies and should these kinds of circumstances occur, I would have to continue to declare a public health emergency. Moving forward, I'm hoping that maybe this might be the last declaration. Again, we'll see what happens in these next 2 to 3 weeks or month. And so my public health emergency extension is to allow the quick measures that need to be taken to again do preventive measures, to again make decisions and actions and what we need to do to protect our community and protect our people should that need arise. And we will also, I will also continue doing that as long as we are in PCOR 3. And when we go to PCOR 4, this is a situation of where we start now planning for a pandemic, future pandemic, and also hopefully vaccines and treatment comes into play. But the decision to continue public health emergency declaration is based on how we are doing as a community. And right now, because we are slowly slowly and gradually lifting, we still need to be in that period of time where we can do the monitoring, contact tracing, and so forth.
Thank you, Governor.
Thank you, Chris. Next is Pacific Island Times, Johanna Salinas.
Half a day, everyone.
Have a day, Johanna.
Hi. So, my question is about the procedure for testing. So, does expanded testing mean that anyone can request to be tested?
Expanding testing means that we are going out into the community, and we are now looking at the second, third, and fourth priority people that we will be testing. And it just means that we now have supplies that we need to be able to test those that are needed to be tested. And it means, like I said, going out into the community, trying to have a better understanding of what community spread is. So when Linda gave the schedule for future or this next 3 weeks of testing, anybody can come to those areas to be tested.
Yes, and I also would like to add that the department is still doing what is called expansion of our testing capability. And again, as the governor alluded, we had additional supplies from the CDC. And so having had those supplies, we're able to now branch out to these respective areas so that we can also identify more cases that may be out there. In other words, we're doing what is called case findings. And again, we're going to these high risk areas. These are areas where they are most vulnerable. They are limited in terms of their ability to find or seek healthcare services. And that is exactly what we're doing.
Okay. So, regarding the extension of the state of the emergency, does this mean that the government may proceed with emergency procurements again without public bidding like they did with the hotels?
This means that if I do need to make that decision, and if we start seeing more positive cases again, and we shift back into the mode of maybe PCOR 1 or PCOR 2, then yes, it will give me the authority to make that decision and the authority to purchase services, goods, and so forth as necessary in an emergency situation to prevent further spread and to protect our people and to save lives.
Thank you,
Okay.
Johanna.
Thank you.
Next is PDN, Jarek Sablon.
Hey, Governor. I wanted to ask you: is the government of Guam working to make more government services online in light of, COVID-19? Just things were shut down for a few months, and nobody could really do anything at some of these agencies. So, is that something you're looking at doing?
Actually, yes, Jared. The lessons that we have learned and seen as a result of this is that people can do telework, and people can use internet and technology to do some of their obligations and their duties and responsibilities. And also, it has been very much demonstrated that we need to really use our technology and and improve our infrastructure so we can provide services online as it's most important, especially during this pandemic, that we minimize our social contact and we minimize face to face. But on top of that, I think it would provide better efficiency and effectiveness of our public service. So DRT, I know, is moving forward to do more online services. I know Department of Labor is also moving forward to do more online services. The Department of Public Health and Social Services, I think they are reevaluating their whole functions and responsibilities to make sure that we are up to date or that we are in the modern times of technology, because manual processing is tedious, it's labor intensive, and not only that, it's not maybe as accurate as we would like it to be in terms of in relation to online technology. So yes, you're absolutely right in that question, and we are working to make that happen in terms of technology and infrastructure for our online networking and online um, services for our people. It's just also more convenient for people.
you, Governor. And my next question is for Linda. Linda, could you explain why public health changed the criteria to release people from isolation? Previously, it was 2 negative tests within 24 hours, I believe, and then now it's changed since May 22nd. Could you explain that?
Yes, we were seeing more cases that this virus is really interesting because even though we had several cases that they seemed to be symptomatic and then later on they were without symptoms, we wanted to make certain that they don't come back again. And so the only way to do that is through, of course, the laboratory testing. We were also examining the possibility that the tests that may come about, we're seeing that they were still positive. A couple tests that were done were still positive, and then we had the inclination that there could be either two things: either the viral load is still there within the test, or the other possibility is that they may be reinfected. And so, having said that, we wanted to take that extra precautionary measure, just like the way the hospital did, where before they discharge anyone from the hospital, they always make certain that that individual gets two tests and that they both test negative each time. And that has been a very effective tool. And we felt that that was through the discussion with our physicians, our US CDC advisor, Dr. Thane Hancock, and also our medical director, they came to that analysis that the 2 negative tests would be very much sufficient. And that is the reason why we went that route.
Thank you, Jarek. Next is the point, Oyal Niraregla.
Hi, happy Friday, everybody.
Thank you.
The first question is for Ms. Linda. Ms. Linda, what steps are being taken to help open childcare centers in light of both government and businesses reopening and people returning to work?
Yes, in regards to childcare, we're looking at the children to be one of the last PCOR 4 with the schools because, again, children are susceptible just like the adults, the elderly. And also, children are super spreaders of infection. They can spread it from one area to another very rapidly. Right now, the way things stand is that the daycare centers are closed, but they can have their staff come in and do administrative work. In other words, cleaning up or getting their place ready and improving it with plexiglass or whatever is necessary to fix their area so that it is in confinement to the operation requirements that we had issued. What we also want to say is that the daycare centers, however, are not allowed to bring their child if they're an employee with them to work or operate with any children in the facility. And so that is in place right now. And the measures that we're also taking is that there are 47 licensed childcare facilities and 44 are covered and provided assistance by the Department of Public Health and Social Services through our child care development funds. In line with that, the department has been issuing some funding from the CCDF, and I'll just give you an example. We issued some funding in May, 369,847, and that was for the CCDF providers, and that's based on enrollment and not on attendance. And we also issued another funding to these areas of 452,066.50. And that's again issued for March. Now we haven't issued May yet because we issue it at the end of the month. So that will be going out very shortly. So that's the CCDF funds. However, the department is also in its final phase to issue out 6.4 million that is coming in from the CARES Act. And this 6.4 million will be inclusive not only of those 44 centers, the daycare centers that are covered already through our CCDF program, but it will include all the 47 licensed childcare facilities throughout the island. Now, what has had to happen is we have at the department have already submitted our plan, which is required to get it submitted through ACF, which is the Administration for Children and Families. It's a federal government. And this plan will provide us information to them as far as how we plan to pay the daycare centers, their consideration in terms of buying partitions or glasses or anything, the equipment or supplies for their daycare facility, and how they also will utilize the CARES Act funds to be in accordance with anything that they'll need. And this funding can also pay for personnel, their rent, their mortgages, any overhead costs affiliated with their daycare, whether it's power, water, and also equipment and supplies. And so right now our staff are doing the final phase, which is just routing it to the AG. And once it is done, then it will be reviewed for legality and form. And from there, we already established the account, and that money has already arrived. And we're ready to disseminate and distribute those funds as soon as the AG approves that.
Ma'am, if I can just sort of re-clarify my
Yeah,
question.
can I just add something here also? You know, as we move from PCOR 1 to PCOR 2 and to PCOR 3 and ultimately to PCOR 4, what we're saying and what is being demonstrated is that our risk of exposure to this virus and our risk for increased community spread is decreasing and declining as we move from one phase to the other. And so one of the reasons that we didn't want to open daycare centers right away, we wanted to make sure that as we move from these phases, from these PCORs, that we are in an environment or in a period where we have less risk. And this is a way to protect the children of these daycare centers. And also, as you realize, and of course know, children are not very adherent to social distancing. You know, they probably won't use their mask. And so it's hard to put those preventive measures in those centers. So the most safe time to open them up is in the time where we have less coronavirus in our community and we have less risk, in order for us to feel safe and comfortable that our children will be protected in those daycare centers, because it's a congregate place.
Thank you, ma'am. Switching gears just a little bit, Governor, on Wednesday, you said that there would be no testing done at the airport for arriving passengers. Considering
I'm
that
sorry.
governments that are,
Oh, no testing, sorry.
yes, ma'am. I'm sorry, did I state that correctly?
No, I just didn't hear you.
Oh, okay, I apologize, ma'am. On Wednesday, Governor, you talked about testing, or not testing rather, at the airport for arriving passengers. Now, considering that governments that are primary tourism markets, South Korea, Japan, and Taiwan,
Right.
have robust quarantining and even testing at their airports to protect the health and safety of their citizens and visitors, do you think that temperature checks and monitoring sends a strong enough message to those potential visitors that Guam is working to provide a safe and COVID-free vacation destination?
First of all, I think the announcement that I made about opening up tourism for July 1st is again a date that we are targeting, and it's a period of time from now to July 1st to work with the travel advisory group that I have put forward, which are also working with these countries. And we felt that these countries, which are Japan, South Korea, and Taiwan, who are the least now risky, I think, in terms of coronavirus, working with their government to see what is their requirement for returning residents. And I would assume that if their requirement for returning residents is quarantine, people might not want to travel. As far as being a safe community, I think if we showed to them our cases of positivity, which is below a 3%, and also the fact that we have a fatality of 5 and we only have 172 positives, and our recovery rate is in the 80s. I think those are demonstrations of being safe. And I think measures, although there is a discussion in the travel advisory group, Oya, about not testing those individuals that are coming from these countries. That hasn't yet been finally decided. The discussion is still ongoing. And so we hope to maybe make a more definitive decision with that before July 1st. So the issue about not testing isn't really a final decision. The non-testing are those people that are returning residents. We are not requiring them to be tested effective on Monday, June 1st, that when they do return back to their homes, we are not requiring them test, because we are allowing them a choice of being self quarantine. The reason we were testing people that were coming in, returning residents, is because we were mandating that they be quarantined, and the test was going to show us the possibility of them being home quarantined. But now that we are lifting that and allowing our returning residents to have a choice of being home quarantine or government facility quarantine, we didn't see the need for the testing. And so, again, I just want to reiterate, there's really no final decision, Oya, in terms of what we are going to do with the tourist industry in regards to testing. Regardless, we are going to continue our monitoring at the airport of the thermal scanning, survey questioning of the people, asking them about symptoms, asking them where they've traveled, those kinds of situations that would give us some idea about the risk that we are taking.
Thank you, Oya. PNC, Kevin Kerrigan.
Good afternoon, everyone. This question is for the governor. For clarity on the issue of differential pay, we understand the differential pay will end Monday for Cat 3 employees. Can you review for us who are these Cat 3 employees and who are the types of GovGuam employees that will continue to get differential pay?
So the category 3 employees, Kevin, are these employees. They're more your administrative employees. They're more the backroom support employees. These are employees that are not in direct contact with people for most of their job duties. These are employees that, support the facing services. These are employees that, again, run the operations and the back end of the business. And so those employees, if you remember that these differential pay was based on risk. And so these are the employees that have no risk or very, very minimal risk to exposure to COVID virus. So the employees, those essential employees, the frontliners that we have identified, are your firemen, your policemen, your nurses, your healthcare workers, people that are working the quarantine, those people who have a high frequency and high exposure to the risk of coronavirus infection. So those people will still be paid differential pay.
And as a follow-up, did any GovGuam employee who has not been called back to work and who has not been on the front lines, who's been at home for the most part and not working, did any of those GovGuam employees suffer any loss of pay or compensation as a result of this 2-month shutdown?
No, they did not suffer any loss of pay. Those employees were asked to stay home, and but they were to be ready at a 2 hours notice to return to work. So although they were not, and a lot of them were doing telework also, Kevin. A lot of them were doing work through telephone. People needed some answers to some questions. People needed some clarification about things. And so, although they're not physically in the facility that they are normally at while they are working, they are at home. But for the most part, they are teleworking and also helping support the public service.
So everyone was working. There are not GovGuam employees who are getting paid and weren't working.
No, everybody was working for the most part. Yes.
Thank you, Governor.
Thank you, Kevin. Guam Daily Post, Heidi Gilbert.
Good afternoon, Governor.
Good afternoon, Heidi.
So now that there are projected costs to the double pay, what are your thoughts on it? Has GovGuam asked the federal government if CARES Act funds can be used for double pay? And will you consider working with the legislature on streamlining and specifying who gets double pay?
So we're still in discussions with the U.S. Treasury in terms of whether the CARES Act will be allowed to be used for double pay. They did say, I was just talking to former Congressman Madeline Berdaliu, who attended the NGA's executive director conference, that there's going to be more guidelines coming out, especially, and also Ed Burns, who also attended an NGA group meeting, in relation to the applicability and the allowable expenses for this coronavirus fund. So as far as it being allowed for double pay, there are some guidelines right now that says you cannot use it for workforce bonuses, and you can only use it for hazardous pay. So there's, we need to clarify the definition of double pay. Is that hazardous pay or is that a bonus pay? Those are some things that need to be decided upon and to be clarified. I do know this for a fact, that if we cannot use CARES Act and we have to use the general fund, depending on what which bill, there are 4 bills in the legislature, depending on which ones, I have always stated, and being fiscally responsible, I cannot afford the double pay. If I'm mandated to pay for the double pay, that means I will have to look into furloughing people. And, when we talk about fairness and equity and so forth, the discussion and consideration there is, do we pay double pay for some people? And as a result, we have to furlough other people, which then means they don't have any pay. These are the serious discussions that are being made with both the legislature and our fiscal team and our administration. We want to make sure that we provide the employees with fairness and equity. And and so these are the discussions that are being made. How can we move forward with a decision that I feel employees will be fairly compensated for the work that they are doing throughout the whole government?
Thank you, Governor. My second question is, we've heard that some game rooms have opened and people are patronizing gaming parlors. Tax has won a Superior Court decision on March 14 that rules authorizing gambling devices are invalid. What are your thoughts on game rooms operating again, and on game rooms in general continuing to operate despite the court decision?
Right. So I am not aware that game rooms are open. I would have to check with Department of Revenue and Tax on what investigations they are doing, and maybe they need to go out and assess that. I know that the case about the game rooms is still ongoing because there's an appeals process going on. So, I'm not. I don't want to make any comments about it. Only that the court the court proceedings are continuing on.
But Governor, in your public health emergency declaration and any memo or EOs, do game rooms fall under any of those categories of businesses that can operate now?
No, they're not under the bars. They're not under restaurants. These are, I don't know. They're not a sport. They're not an exercise place. They, we haven't really even thought about that. So there isn't a clear direction on what these game rooms should be doing. And I'm assuming it's close because it hasn't been identified as a restaurant or as an exercise place. So those kinds of entertainments, those kinds of businesses are not allowed to open because they have not been identified to be open.
Thank you, Heidi.
Thank you.
KOAM, Nestor Lecanto.
Hi, good afternoon, Governor. Good afternoon, Linda. Are there any Guam residents that are currently under quarantine in any of the government facilities? And if so, under the new protocols, will they be allowed to go home and quarantine at their residence?
Yes, there are several residents that are there. And yes, by Monday, we just had a meeting today with all the agencies that are working in the quarantine area. And yes, there's a plan to release them to continue their 14-day quarantine at home.
Okay, I'm sure that's going to be good news for them. Second question, I guess it's one of the most frequent questions that we get in the media, and I'm sure, Governor, that your administration probably gets it too, is particularly from those who have not yet received their economic impact or stimulus payments, and those who are still waiting for unemployment to go online. Do you have an update on those for us, please?
Yes. So for the EIP, the Economic Impact Program stimulus, we just sent approximately 3,000 checks totaling 4.7 million to DOA, and so that should be moving out. I think by Monday or even today. And Nestor, we have, since the program has started, approximately $117.9 million of stimulus checks that we have put in the hands of our people. Additionally, the status of the Programan Salapi, we have to date cut and distributed out 17,040 checks for households. These are households. So we're looking maybe 30,000 people, 40,000 people. And as a result of that, we have put in the hands of our people $12.8 million worth of the Programan Salapi. As far as the pandemic unemployment, we are moving along as quickly as we can to be able to get the online application up and running, and we're targeting for this weekend. And so once we do that and the online application goes smoothly, and if people look at the checklist that's been going out there of what you need to do your online application, and we go very smoothly and they are approved and they become eligible, we have to, within that 21-day period, issue the check. So it doesn't mean we have to wait for 21 days. It means that as soon as we can certify these individuals, the checks will be going out. So the checks for the for the pandemic unemployment program has not yet been issued out, but we are ready. The money is here, and we're just trying to quickly get our online employee applications launched.
Thank you, Nestor. Mariana's Business Journal, Wayne Chargaloff.
Half day, everyone. We've heard that in some jurisdictions, there have been issues where coronavirus CARES Act related financial assistance has been counted against has been counted as a resource or funds for against other federal programs like SNAP. Like someone gets a stimulus check, then that's supposed then there need to be clarification of whether that gets counted as income for the SNAP program. Does Guam have any issues with that at this time?
Not that I'm aware of. No.
Okay, as far as the so there's you don't foresee any that becoming a problem at all as far as like the way the law has been written?
No, I don't think so. I do know that the CARES Act money at one time cannot be used to help fund another program, federal program, but FEMA has just told us and informed us that we can actually use the CARES Act money as our 25% cost share for the FEMA assistance. But as far as SNAP, I'm not familiar with that. I can go back and check. But even in our monitoring and in our following up of these federal aids through DRT and also through GITA, that has not been an issue.
Okay, and for my second question, there have also been jurisdictions where they had issues with EIP stimulus checks going out to deceased residents. Have there been any issues like that on Guam, and is there anything in place to prevent that?
No, not that again I'm aware of. I know that we are having some return checks for the economic stimulus check. I think we have about 200 and some that have been returned, and it's either because the address is not, current, and we're going to try and find these people. But as far as being deceased and getting a check, no. I do know, though, as you are aware, that there's been fraud there has been a fraud case where people have tried to duplicate or tried to forge stimulus checks and tried to cash them in some MSBs, but they were caught. The checks were found to be fraudulent, and I understand from the police that they have been arrested and a suspect is being pursued. So, but as far as a deceased person receiving a stimulus check, no, I'm not familiar with that.
Thank you.
Thank you, Wayne, and I'd like to thank all the members of the media for their participation today. Some closing remarks, Governor?
Yes, thank you. I just want to say that our progress in our journey of this pandemic has been really good. And things that we have ourselves locally had done, our strategies that we have done, and things that we have anticipated is what we are seeing today. And again, those are real good signs. And like I said, we are going to be continuously monitoring and lifting up restrictions. And I just want people out there to know that I will not at all jeopardize the safety of our people. And, but we also have to start moving forward and trying to get our lives back to normal. And so it's a fine balance that I am dancing, if you will. However, we will continue on to do what is best for our community, and based and also guided along with the experts and also data and science. So again, I just want to say, as I go out there, people have been very appreciative of our work. People have been very grateful for the the aid and assistance that they're getting, and I just want to thank them for being very patient. But I think we are moving forward, and I feel there is a light at the end of this tunnel, and we can slowly get back to our normal lives. But I do need your cooperation still to try and contain it. And so please do follow the conditions that we have made in opening some of these places, and wear your mask, and also adhere to social distancing and minimize social contact.